It's holding on to excess body weight. People don't realize this, but holding on to that excess weight, especially visceral fat, it's dangerous. I think that's one reason why a lot of people do go on a GLP-1, because it helps with that insulin resistance.
So what's the difference between visceral fat and normal adipose tissue? If you have chronic fatigue, there's a good chance that you're carrying visceral fat. So what is visceral fat? Visceral fat it packs itself around the organs, and especially like the pancreas, your liver, really highly toxic. Visceral fat is by far more dangerous than adipose tissue. Adipose tissue with your normal storage of fat that you're using for energy. The signs are, one, chronic fatigue, for sure. You'll see men do this. They'll start packing on visceral fat earlier, and then really hard stomach. You can't squeeze, like area that is fat-ish. That's generally a lot of visceral fat. Whereas your adipose tissue, you can squeeze. You can use it. That's not nearly as dangerous, and you want some of that around the body. When your knee and your joints hurt with regularity, you're carrying probably a lot of visceral fat. Those are probably the two symptoms that come to mind most often. And then obviously your pants don't fit.
Right. People are using a tool like a GLP-1 to get rid of that dangerous excess visceral. We're not talking about skinny. It's about just being healthy and getting rid of the visceral fat as much as you can because of what it does to your body. It's the more mass you hold, your body's working, your heart's working harder, your cardiovascular health is at risk. Many reasons to get healthier. That's why we talk about walking after every meal and eating whole, real foods, right? And again, this isn't about skinny. It's about just being healthy. Where are we going to start? We're overweight. What are the baby attainable steps that I can take to get rid of this excess body mass?
We talked about the heart diseases that happen, the liver diseases, the insulin resistance or type 2 diabetes. These things are highly dangerous, but there's ways to reverse it really in an efficient way. One of the fastest ways to reverse visceral fat specifically is lifting weights. When you lift weight, it is especially heavy. It partitions or your fat loss from visceral fat by a huge proportion. It's one of the most effective ways